Like many young men and women, when I was asked, what do you want to be when you grow up? There was probably a point in time in my life when I said, I want to be a fireman. It was later in my career as a physician interested in the prevention of heart disease and the prevention of diabetes that I became aware that firefighters had a particular risk of sudden heart attack. And I didn't know that growing up. I knew that firefighters were vigorous and active and much admired, but I never realized that they had a particular risk of heart attack. So I took it upon myself to take a special interest in this and see what could I do working with my local firefighters, my local fire chief, and the department. What can we do to maybe improve the health and reduce that risk? In the United States, there are over 1 million firefighters. In North Carolina, we have nearly 60,000 firefighters. Again, about 3/4 of them are volunteer and about 1/4 are career. And in my community of Cherryville, a small town of about 5,000 people, there are 42 firefighters. Firefighters are at much greater risk of dying from a heart attack than from an actual fire injury. The #1 single cause of death among firefighters is a heart attack. That's true in North Carolina. We lose anywhere from 2 to 6 firefighters in North Carolina every year due to a fatal heart attack. About 1/3 of those happen en route to a fire or coming back. About 1/3 occur at the scene, and then about 1/3 occur at other times, during training, during other events. I decided that I could do something about that. I can work with my fellow firefighters in my community and change those statistics. The consequence of that is that we've increased awareness among those firefighters of this risk of heart attack. We've made them more aware of their risk of diabetes, and they have been incredibly motivated. They formed their own task force and said, Dr. White, we want to work with you. So here are 4 of our firefighters. Let's form a task force. Let's look at our health risk. Let's look at what we can do to improve our health, reduce our chance of a heart attack. And so together we've done that. It was their idea to start a Biggest Loser campaign to see which of the firefighters could lose the most weight in 6 months. It was their idea to start a log so everyone logs in with their monthly weight. It was their idea to keep a log of their exercise routine. They had a gym, they had a workout fitness center in their fire department. They're more motivated to use it now. Firefighters have a motto of always 2 in and 2 out. So they're very focused on teamwork and making sure that their comrade, if they go into a fire with them, they both come out together. They look out for each other. So we've tried to instill some of that same philosophy for this, that you are your brother's keeper and he is yours. And if he's at risk for a heart attack, so are you. And you need to help each other.